Hi, I'm Dr. Jared Gardner, and I wanted to make a video to help those med students out there who are going through the process of deciding how to make their rank order list for the match to choose their residency program. Now, I'm a pathologist, and so my experience mostly involves pathology, but I have given advice to many medical students over the years. I've trained a lot of medical students. I've worked with lots of residents and fellows, so I've thought a great deal about what goes into making that decision of what the best residency program is for you, and what things about a residency program really stand out as important to me now. Looking back, I've been in practice almost 9 years now, and I did 2 years of fellowship. So it's been over 10 years since I graduated from residency. I'm getting old now, and I've started to think about the way things are now in my practice and how that relates back to the kind of training I had in residency. You're all smart people watching this. You're medical students. You know how to make a spreadsheet and compare all the pros and cons and the various things about each program. So this video will not focus so much on that because I know that you know how to do that. But sometimes that process paralyzes us, right? The problem of, oh my gosh, there's all these great programs. How do I pick between them? Well, if you're in that situation, that's a great problem to have. If you've interviewed a bunch of places, you think they're all awesome and you just can't decide between them, wonderful. If the top 10 programs on your list are all places that you're probably going to be happy at, that is a great problem to have, actually. But I think there's a lot more of a kind of an emotional aspect to making these decisions and some softer features that are not hard data that you can compare so much on a spreadsheet. So let me talk to you about some of those. I'll try to put a little summary in the video down below so that you can skip forward to the parts that are of interest to you. I have no idea how long this will be. I just jotted down a few notes and I thought, let's just make a video. Hopefully it'll be good enough. It doesn't have to be perfect. And I guess before we go any further, let me give you that advice. Take a deep breath and realize that making your rank order list, it doesn't have to be perfect, okay? Yes, some of you are probably all-stars that have incredibly high scores, and you may very well get the very top choice on your rank list. So I understand there's some pressure to make sure the top choice is the very best one. But remember that the process is not 100% up to you. It also is up to the program and the way the match algorithm works. So, put your rank list down, but it doesn't matter if it's not 100% perfect, okay? Whatever program you end up at, again, as long as you've got great programs that you think are going to be overall good matches for you at the top of your list, and you get one of those, you can make it the perfect program for you over time, okay? So that would be my one advice is try to let go of that perfectionism. And I know that's hard because in medicine, we all are very driven to be as precise and perfect as possible. But sometimes that strength that makes us good at a lot of things in medicine can also be a bit of a weakness. At least I know it can for me. Sometimes perfectionism gets in the way of making progress or making a decision. So I think one thing that's really important about a program, at least in my worldview or in my way of thinking, is the culture of a program. And the culture of a program is a difficult thing to nail down and even to define. I guess the way that I would say it is the feel of a program. Now, I'm making this video in February of 2021, and as all of you know who are watching it this year, hopefully in the future years this won't be applicable anymore, but those of you this year know that the whole entire interview process for residency has all been done virtually. You're making decisions about programs and how to rank them, and you've probably not even stepped foot in many of these different institutions, maybe not even in the city or the state where the institution's located. That adds an enormous extra amount of stress, and I understand that. It also makes it harder to get a real feel for what the culture of the program is, what the feel of the program is. So I think, though, at least back in the traditional times when we got to go and travel places and actually interview and meet a lot of residents, I think that the way the residents feel about their program and about each other says a lot about the culture. Are the residents overall happy at the program? Look, residency's hard, okay? And I know pathology is maybe not quite as hard and time-consuming of a specialty as some of the maybe surgical subspecialties, but it's still a lot of mental, strenuous work. It's a steep learning curve, even in our field. And I know if you're a neurosurgeon out there, you're probably, or an ortho or something, you're probably laughing. But hey, I understand and recognize that some of you have way harder residencies even. But in any medical residency that you're going into, it's going to be work. You're going to be spending a lot of time at the hospital and a lot of time around these people, the residents and the faculty and the other members of the staff of the program. I think that in general, I would want to spend time at a program where I liked the people that I worked with overall. And that's been an important factor to me, not only in my training, but also in practice, in my job. Life is too short for me to work with people that I really can't stand being around. That I've been so incredibly blessed and fortunate to the 2 different jobs I've had have all been with wonderful people, wonderful colleagues who I trust and respect. And let me tell you, that is priceless. And I think the same holds true for residency. So, there's nothing perfect, and every program's going to have some strengths and weaknesses. Everyone's going to have a bad day sometimes. People are going to get in disagreements. But in general, do the residents respect and work as a team with each other? Do they in general like being around each other? Do the faculty feel that way and interact that way with the trainees? I think, to me, that's a really important thing. Hopefully there are fewer and fewer programs with malignant environments nowadays. I think that used to be a much more common thing in the past, but I'm sure some of those programs are still out there. And ideally, I think avoiding programs like that would be something important to me. Maybe you feel differently, but like I said, I know I'm going to spend, if you're going into residency, you're going to be spending a lot of time over the next few years at that hospital with those people. I think that you would want it to be with people that you can respect and get along with. And remember, your residency program is going to be your home, not just for those few years, but it's going to be your basically alma mater, your training home that you look back to through the rest of your career. Other people will not necessarily remember where you trained or even care once you're in practice, but you'll always remember that. And it's good, I think, to pick a place that you can look back on and think, man, I'm so glad I trained there. The place where I did my residency, Houston Methodist Hospital, man, I loved the people there. I loved training there. I look back with such a deep sense of pride and thankfulness for getting to train at that program. I would choose it again in a heartbeat for me because, again, it's like my home. It's my medical home. It's my pathology home. It's where I got my roots and my foundation. So that's what I'd say about the culture. And again, I think the people that can really help you flesh that out and get an idea is the residents. If you're still having trouble deciding, talk to some more of the residents and people at the program. And again, just ask them things about like how happy they are, and if they think it's a great program, what would they change or make better about it? Hopefully you've already asked some of these questions. And again, every program should have something that can be made better. If not, it means we're not thinking hard enough about how to improve. And I should point out, I used to be a fellowship program director, and I've been heavily involved in resident training and on the committees that oversee residency programs, both in my current job and my previous job. So it's something that as a leader in a program, I take that very seriously. We should always try to make a program better, and we should have that attitude as a program of wanting to constantly improve. I think that's another important part, I think, of the culture. Is it a culture of innovation and willingness to constantly improve, or is it very rigid and stuck in its ways and this is how we've always done things and we're not changing? I don't know, maybe some people can cope fine with environments like that. I'm a little bit oppositional defiant is what my wife says. She's a psychiatrist, so she's probably right. But in all seriousness, I like to innovate and change things and make things better. And when people tell me no, I have trouble with that a little bit. So maybe that's one of my many character flaws. But in any case, I think a program that's willing to innovate and improve itself is an important thing, and that's in general a good sign about a program, and a good sign that you can be a part of making that program better over your few years there as a trainee. The other thing I think is really important, and I did not recognize it as much when I was in your shoes as a fourth-year med student, but I do so much now looking back, 10 years after training, is the importance of mentors and faculty who will take you under their wing, who will not just teach you diagnostic pathology or how to do surgery or whatever field you're going into, that they'll teach you more than just medical knowledge, but really give you guidance about how to be a good doctor, how to balance work and personal life, how to make decisions about your career path and what you want to become as you go into practice, not just your specialty, but what kind of career you want to have. Do you want to do private practice? Do you want to be someone who teaches and gives, invited talks and does research or writes, or do you want to work in a small community place, or in a huge academic center? There are a lot of different decisions to make along the way, and you have to make those decisions for yourself, but having faculty that are willing to kind of help guide you through that journey and that mental process of thinking through and weighing your different options as you progress in your career, that's priceless. And I tell you, I learned so much from all of my mentors, but some of the things that I cherish the most are not, again, as a pathologist, I was taught lots of things, how to make this diagnosis for this tumor versus that, or use this immunostain. And that stuff was all important and critical. But some of that has even changed in just the 10 years since I practiced. But the things that haven't changed are those deeper philosophical lessons about how to be a good doctor. Mary Schwartz, one of my favorite pathologists of all time, one of my greatest mentors, like really seriously one of the most awesome pathologists. She said many great things, but one of the things she said that stuck with me is, always know what's going to happen to the patient because of the words you write in your pathology report. So as a pathologist, that's a great life lesson for me that has nothing to do with exact diagnosis, but it has something to do with thinking bigger than just the act that I'm participating in medical care right now, thinking at the bigger picture of the patient and, how to make sure that, if this is going to make a huge change in their care, that I need to be extra sure that I'm right. We always want to be right, but you want to be extra sure you're right when a lot rides on it, And I don't know, I even remember thinking how meaningful that was the moment that she said it. But I've thought about it many times over the years, and it's helped me to avoid mistakes and to perform better as a physician. And I hear her voice in my head as I continue to repeat those words to my own residents and fellows and med students this very day. And that's just one example of the hundreds or maybe thousands of different little pearls of wisdom that I've gleaned and picked up from my mentors. And the way that I recognize they're important at the time, again, I didn't necessarily realize how fundamentally, amazing these things were until I hear their voices echo in my head years and years later as I'm saying those same exact words to my own trainees. And it's now looking back that I realize those mentors, those people that they made me not just the pathologist I am, but the doctor I am, and even in some ways the man and human being that I am today because of that really important foundational work that they laid down during that formative period of my professional and personal development. So find a program, basically, sorry to gush so much, but that's just how deeply I feel about it. And I didn't realize it when I was a fourth year med student or even as a resident, but the further I've gotten into practice, the more I've realized how priceless good mentors are. And, how do you know who's going to be a good mentor? Well, that's hard to know because some places, some people are famous and well-known and really smart, but they're really busy with other stuff and they don't always have as much time or maybe don't have the skill or the interest in doing mentoring. Just because someone's really good doesn't mean that they're necessarily going to be a really excellent mentor or even available as a mentor. But I think that it is important to find a place where the faculty are people that you look up to and respect, and that you want to kind of grow up to be like them when you're a fully fledged, fully trained physician in the future. Find a program with faculty who you want to emulate, and then go to that program and suck all the wisdom and knowledge and experience and guidance that you can from those amazing people, and then try to emulate that. Because I think that's another thing is it's not just the individual teaching points or pearls of wisdom or bits of data. I feel like the way that my mentors impacted me is also in the way that they just practiced medicine every day and the way that they held themselves professionally. I learned to be a leader by watching all of the people that were senior to me lead. They were involved in professional organizations and national societies, and they served on committees, and they did all these things, and I just thought that's just the normal thing to do. And then I realized that not every doctor does that. This is something that a select group of people really choose to be involved in, and I watched all of my mentors do that, and then I emulated that in my own life. And so they were basically role modeling for me behaviors and activities that have helped me to become a much better professional and to pay it forward by paying back into my field and making it better. So I think those are some things I think about with mentoring, is finding people who you want to emulate, and ideally people who will have the time and interest in taking you under their wing and mentoring you. And it's more than just the teaching and mentoring too. Having people who will step up and go to bat for you and sponsor you. Some people call that sponsorship. People that are going to send an email, write a letter of recommendation, make a phone call on your behalf to open the door for you to get a fellowship, to get a job, to get a committee position, to get on an editorial board, whatever you're looking into. I did not realize, certainly when I was a somewhat arrogant young fourth year med student and I thought I was pretty smart and that I had it all in the bag on my own skill, and looking back, what a fool I was. It was not, I'm sure I was smart and I worked hard, but it was because of so many people who were behind the scenes, unaware. I was unaware of it. They were behind the scenes making phone calls on my behalf and saying, hey, I know this guy's a little bit of a young punk, but I think he's got some potential. Maybe you should take him to your program. So I'm talking to you, Byron Crawford, if you're out there watching this. One of my med school mentors who I found about later had, just been promoting me behind the scenes, and it made a difference. It made an impact and a difference, and I think it really did change where I ended up getting into my residency. So I'm incredibly grateful to people like that who were willing to vouch for me. And I used to think, well, everyone gets good letters of recommendation, but having now read hundreds and hundreds of letters of recommendation, there's a good letter of recommendation, and then there's the solid gold, glowing letter of recommendation, the personal note written on the letter, this guy's really good, this woman is amazing, you should take her. When that kind of a message, personalized and handwritten, or with a phone call or a text message, comes from another doctor who I know and trust and respect, let me tell you, that plays a big role in my decision making if I'm trying to choose a fellowship applicant or something else like that. When I get that kind of personalized, above and beyond kind of message. Again, that's something that people only do if they really, really think that their trainee is excellent. They're otherwise not going to take the time and the effort to do that. So people that will take the time and the effort to promote you and help you and open doors for you, that is priceless. And I know it's kind of hard sometimes on the early end to find places like that. But again, ask the residents, because a lot of times the residents can give you examples of, oh yeah, Dr. So-and-so, they did this and that, and they called up the head of this department and recommended me for a fellowship, and I ended up getting it. And it opened the door. It's not going to make up. You have to still be excellent, right? No amount of praise from a senior person is going to make up for lack of skills or anything like that. But you can be really, really good, and sometimes if you don't have someone there to open the door for you, it can make it really challenging to make progress in your career. And that's an unfortunate but real truth of how the world works, and I think having people that will promote you is really important. And then sometimes, people wonder, well, should I choose the program I really like or the famous big name program? Now, look, I was lucky. I trained at some famous big name institutions or spent time at them, and it was great. And a lot of big name places are famous for a reason, because they're awesome, amazing places to train. But I think when you're weighing it out, in my worldview, in my way of thinking, I would rather go to the program that I felt had the overall best fit for me and the best overall mixture of specimens or patients, whatever it is your field entails, that's going to help you be prepared for the kind of practice you want in the future. I would choose that, even if it were a lesser known program, over a really famous program that I didn't feel was quite as good of a fit for me. Now, say you grew up ever since you were a kid wanting to go to some famous, institution, and that's just been your dream, and your parents have been buying you clothes with that logo on it since you were a baby. If that's your dream, man, go for it, go do it. But otherwise, I would say don't just let a name of a place sway you if it doesn't otherwise feel like it's the best fit for you. And I'm not saying that, again, in any way to belittle any of the wonderful famous institutions out there, many of which I have amazing colleagues who work at and who are amazing, and I've heard wonderful things about those programs. But I do think it's important that to me at least, I don't think going to a place that has a big name or is famous is more important than going to the place that I really feel is the best overall fit. So you have to decide what your value system is and what's more important to you. Another thing that I'll put out, and it doesn't apply maybe to all of you, is are you interested in a competitive subspecialty fellowship after your residency? In pathology, for example, pretty much everyone does at least one fellowship, and a lot of people do two. And some of those fellowships, like my field, dermatopathology, are relatively competitive. And so I feel like if you're applying, say you have an interest in dermatopathology and you're applying to pathology residency, it is going to be beneficial to you to go to a program that at least has a dermatopathologist there, and ideally has a fellowship there. And I think this same general rule can hold true for any sort of field. If you're going into dermatology and you think you might be interested in Mohs surgery, going to a place that has a Mohs surgeon or ideally a Mohs fellowship, it's going to give you a chance to get more exposure to that subspecialty, potentially to participate in research related to it. And those people who know other people in that niche area of medicine are going to be able to introduce you at meetings when we hopefully go back to having meetings one day after the pandemic, and they're going to be able to open doors for you, right? So I think that it helps you. And it's not impossible to go into a competitive subspecialty coming from a program that doesn't have as much access to that subspecialty, but it can be harder. I don't know how this applies outside of pathology, so make sure you ask the mentors and specialists in the field that you're interested in to give you guidance for your specific field if you're not a pathologist. But I'd say, at least for pathology, I've definitely seen times where residents developed an interest, say in derm path or one of the other more competitive subspecialties, but had trouble getting research projects and posters because they just didn't have that many cases of skin, and they didn't have a derm path mentor at their institution, and it made it harder for them to build up their CV and to get that access and exposure that's going to make them a competitive applicant when they apply for a subspecialty fellowship. So, I went to a program that didn't have a direct dermatopathology fellowship there, but I had access to institutions across the street that were partnered with mine where I could go over and do a month here or a month there of derm path rotation. So it worked out just fine for me. I think having that exposure, though, to whatever your competitive subspecialty interest is probably going to, in general, be beneficial, and potentially could be detrimental if you go to a program that doesn't have that. Now, I hope I'm not making too many programs out there upset by saying this, but I want to be here as an advocate to try to help you as students making this decision. And a lot of you might be like, I have no idea what subspecialty I'm going into, but some of you may have your heart set on it. And you know what? If you do, you may change your mind later, but I would always say if it's a competitive subspecialty you're interested in, it's better to try to prepare early. And then if you change your mind later, what have you lost? Yeah, you've done a little extra work writing a paper or going to a meeting, but you've learned and you've gained experience. And then if you change your mind and decide to do something less competitive, there's no harm done. On the flip side, though, the opposite of that is not always true. If you wait until later and then suddenly decide, oh, I'm really interested in this competitive subspecialty now, and I want to do a fellowship in that, but you haven't really done any of that work early on, you're going to be behind other applicants, and it's going to be a little bit harder for you probably to have as competitive an application. So if you think you might be interested in a competitive subspecialty fellowship, just keep that in mind and maybe weigh that into your decision making. It shouldn't be everything, but it is something that if you're between two places and one of them has more access to that subspecialty fellowship interest of yours, I would say that that would weight higher on my list to move that up the rank list. And then, I think the final thing is you really just have to recognize again that the match is going to make some of this decision for you. Make a list. It doesn't have to be perfect. And when you go to the program, you can help make it the perfect match for you. It's kind of like, I think, in a relationship, right? I mean, you may or may not believe in love at first sight or whatever. But, I do think that regardless of if you believe that or not, certainly I think that when two people feel like they're right for each other, they can become more and more perfect for each other over time as they both work together and become, a partnership. And I think the same, and maybe that's a little weird analogy, but it's kind of true. I think the same is true of trainees and programs. They can work to be a part of the team and a part of the program while they're there, working as a team for good patient care, supporting and encouraging and lifting up all of their colleagues, helping the faculty out, making life easier for everyone around them. And you're going to feel better about having that kind of attitude and participating in building up and strengthening your own program and making it something that you can be even more proud of, and that you can say, I left this place better than I found it. Maybe I'm a little idealistic, and I know that you can't always do that every day. Some days we're just too exhausted. But if we try to have that attitude and approach our work or our training that way, I feel that benefits the way we feel about it and the way we feel about being a participant in it. And it, of course, benefits everyone around us. So I don't know if these things will help you or not, but I hope that they give you at least something a little different to think about rather than just, what city is it in and what are the benefits and the retirement plan and all that kind of stuff. Those little data points that can be really hard to sort out. Think about some of these things a little bit outside the box, and I hope that will help you a little bit in making your rank order list. I hope that match day is the happiest day in the world for you, that you get the program of your dreams. And, even if you don't get exactly the program you're thinking for, go to wherever you go and flourish there and give it your all and do your best for patient care and remember why you became a doctor. And sometimes it's hard and it's easy to lose sight of that in the grind of everyday life, especially when things are busy and we're overwhelmed and exhausted. But trying to hold on to those inner principles of why we are there to take care of sick people, I found that for me on hard days, that's what's kept me going. And it's remembering that I'm here because I really love training, my own trainees and helping them do better patient care and have successful careers. I'm here because I want to take care of my own sick patients and give them the best treatment and the best, in my case, diagnostic care that I can. When we try to cling to those principles, I think it can help a little bit. So anyway, the best of luck to you. I hope your rank list gets submitted and finalized by the deadline perfectly. I hope you match the program of your dreams, and I wish you a long, happy, and prosperous career. Thanks for watching.